We stand at a time of unprecedented change, where our clinical abilities are constantly growing within our hospital walls, with needs growing outside of them. Think about our community, our neighbors, our partners. What do they value? When you take the time to ask and understand their needs, the solutions start to look a bit different.
I think that for years, when you worked in the hospital, you thought of a building. You thought that these patients are in a building and this is what we're doing. But really now we have, and for the last few years, we have been looking outside the hospital walls.
So we had a patient who spent about 70 days in the hospital. We found out that he had been working and had lost his job. When he was unable to afford his medications, by not taking those, they caused multiple strokes and caused him to come into the hospital about 3 times over 3 months. Once our team sat down with him, they were able to get him insurance, able to make sure he was seeing his primary care doctor, and once he started picking up and taking his medications, he's been fine, and he's actually been out of the hospital for the last year and a half since that time.
It's been long in coming that we've recognized the need to address the health care of our entire community, not just those that appear in our office. If we are truly looking to improve the health of our community, which we are, it's extremely important to partner with community agencies.
As a community health provider, Westside is primary care provider, and so we know that we can't do it all in our own doors. So all along the way, we've been developing really strong collaborations with Christiana Care to where we are now, which I think is very, very successful and very strong collaboration. The patients that we see have very complex needs. Many of them have not had health care or preventive care for many, many years, and it's a cultural challenge for our providers to be able to take care of everyone.
We have a remarkably diverse community in Delaware, more than I think people realize. Last month we had over 1,600 requests for in-person interpreters.
Home visit program's main purpose is to maintain the patient in the home as long as possible. I think if you remember the old TV show, Marcus Welby, where a doctor showed up with a black bag, that's what we do. Sometimes, as a physician, you might be like, well, you have so many medical problems. I don't know if this is the safest place for you to be, but they're not really concerned about their medical problems. They're concerned about leaving the home they have been in for 50 years.
Anything I wanted, they were there for me. They called me, told me they'd be over. Like I said, I had a doctor, a nurse, occupational therapist, physical therapist. Everything come in with me, work with me when I first come home. So, everything was good. It was great, so I could stay here. And that's the main thing, stay at home.
There was a family that I met. It's been actually 2 years now. And when I first met them, the biggest concern they had was that their mother was living alone and they were living on the other side of the country. The visiting nurses was ordered. We also provided our telehealth program to monitor the vitals on a daily basis. After we had probably about 2 months worth of visiting nurses, we realized that we were coming to a close. But the family was so appreciative of the nursing service that they wanted to keep us on. So 2 years later, I'm still in there on a weekly basis. They're doing this because they know that there is someone out there that's going to continue to monitor their loved ones.
In a previous model of medicine, a physician would dictate to a patient what they needed to do, send them home with instructions, and have them come back to report their success.
Sometimes doctors assume that they know everything, but most people know their body better than doctors, I think.
Everything that we do, I would say, in medical care depends on the patient following through, and we need to assess their level of motivation to reach the same goals that we've set for them. So most importantly, they should be setting the goals and helping us define where they want to go. I
think you can prescribe medicine and prescribe dietary recommendations and things like that, but if you're not hearing the patient, then we're not really doing our job.
Each piece of information a patient can give you is a piece of a puzzle. If you put that puzzle together, many times you get a map to where you need to go. We are now looking at the patient as a whole person. We're now seeing a patient for medical needs, community needs, We're looking at what it's going to take to make them well.
I'm optimistic about healthcare because I feel like it's finally moving towards more of a population health model. And I think that's where the focus should be. When we do something for you or to you, is there value in there? Do we improve your quality of life? Is it cost effective?
You know, really our challenge and the challenge of healthcare systems across the country right now is to figure out how to do what we're doing better, make sure that we're learning from what we're doing, and make sure that we're continually improving. And a big piece of that means finding new ways to do things, and an equally big piece of that actually probably means finding ways to stop doing things that we're doing, right? And so we spend a lot of our time doing things that we perceive to be valuable, but they probably aren't.
The concept that the more care you give or the more things you do to a patient being better is flawed. And I think cardiac telemetry is a perfect example. We found that the interruptions to the nurses cost 117 hours per day in Christiana Care Health System. The nurses would tell us that they couldn't give medicines for one patient in the morning without getting interrupted once or twice. It's important to note that what we did was very simple. It was not brain surgery, so to speak. We just took guidelines that have been published for 10 years, written by the most knowledgeable people in the country, and applied them. The magic of Christiana is that we had a group of people who came from a number of different disciplines and worked closely together to make it happen in a way that would be, I think, very difficult in many medical communities and cultures around the country.
Because of the success that we've enjoyed over the years and continue to enjoy, we have the real opportunity now to actually transform the care that the whole community provides. Bridging the Divides is fundamentally designed to improve the longitudinal care for patients who have stents placed or have coronary artery bypass surgery. Bridges went live as a program in April 2013. Since that time, we've taken care of a little over 2,300 to 2,400 patients.
Our patients, when they leave the hospital, they are overwhelmed and inundated with so much information. So we kind of sort through all that information with them and help them after they leave the hospital towards self-management with their heart disease.
It gave me security. I went home after a surgery like that, and though I was weak and I had to get my strength back little by little, I never felt afraid.
Our community counts on us. From physicians to nurses, to valet, to food nutrition, to phlebotomy, to research, to volunteers, everyone.
5-10 years from now, a lot of things aren't going to look the same, hopefully, if things go right, because we've learned as we've gone through the process.
Respect, caring, partnership, these are the values of the Christiana Care way.
Today, at Christiana Care, we see things differently. We see patients and our role differently. We think knowing how to listen is as important as knowing what to say. We know that speaking the patient's language is as important as translating care from the laboratory to the bedside. We know that the community to which we belong is more than the medical community. And we know that the job of truly caring for our neighbors is never done. So join me, not just in celebrating today, but in creating tomorrow. Let us use our various abilities in amazing, unpredictable new ways. The tools we use do not define us. The way things used to work cannot confine us, because one person who takes ownership can make a difference. This is about finding what we all can add. Innovation, partnership. We want to go beyond what is and ask what's possible.
It's our time.
It's our time.
Es nuestro momento.
It's our time.
It's our time. It's time to be involved.